Medtech product design principles from Silicon Valley.
Hi everyone, lovely to meet you and great to be here. I'm Andy Baynes, CEO and co-founder of GT LifeScience. We're essentially a team of engineers and product technologists building life science tech for clients in North America and Europe. My background is Silicon Valley, so I was part of Apple's product design division for 12 years. And then I left with a small team of engineers to help start a smart home company called Nest, which we sold to Google in 2014. And it was around that time that I became very aware of the incredible tech engineering capability in Eastern Europe. Ended up buying what is now GT, and we now specialize in AI and data science for life science companies. So my talk today is really to sort of compress my 25 years in Silicon Valley down to 15 minutes and share my observations and my top tips, if you like, on how to instill Silicon Valley pace, focus in disruptive innovation into medtech companies. So let me just ask the audience quickly, how many of you are C-suite leaders of your enterprises? You put up your hand. Okay. And so essentially what I'm going to be doing is just sharing tips that are applicable to large organizations, large enterprises, as well as startups. And it's all about product, essentially. So it's going to have a very product focus to it, whether you are a B2C company or a B2B company, and whether you are software or hardware or a combination of the two. So just to put some data on it, when I was part of the product design division at Apple, we were in my 12 years of being there, we were launching a new product every 8 months. The first product I worked on was iPod, and then obviously we moved into iPad and iPhone and all of the accessory products that accompany that, and then the future generations of iMac, Apple Watch, you name it. We were just constantly innovating all the time. And that never stopped. When we left Apple as a small team of engineers and moved to Nest, we maintained that pace and that focus of innovation. And today, when we talk to our clients who are doing drug discovery and clin trials and automating their lab processes, we're instilling exactly the same principles. So what are these principles? I have a lot of principles, but I'm going to give you my top 3. These are the top 3 ones that I would say are most often overlooked in the medtech product delivery space. The first one is obsessively understand your early adopter customers. And so what does that mean? Your customers could be essentially your B2B clients. They could also be, if you're in the medtech space, a private customer, a private individual, or a patient. And all too often what I see when it comes to product development or market launch are clients who are trying to launch to everyone. They haven't understood the gender distribution, the age group, the geographical location of their early adopter market, whether they are researched buyers, what the household income is of that group, and a whole host of other vectors that determine whether you have targeted your launch product or your next version of your existing product to exactly the right audience. So there's something that we, in Silicon Valley, we call the conversion funnel. It's the growth curve that companies use to engage their early adopters, move their product into what we call early mass, and then transition over to what's called mass market. If you're moving at Silicon Valley speed, those 3 phases, even for a medtech company, shouldn't take longer than 3 years. Okay? And you've seen companies like uber high growth, or what we call, hyper scale up companies. Uber in its early days, certainly Apple, Google, Meta, now X, moving along these three phases very, very quickly. You cannot move from early adopters to early mass unless you have identified exactly who your early adopters are. Let me give you an example in the smart home space. So how many of you have heard of the Nest Learning Thermostat? Okay, great. Okay, so you can visualize what I'm speaking. Essentially, it's a smart thermostat that controls your heating and cooling. Imagine that's just a Medtech device that's controlling and monitoring your blood pressure, for example. The same sort of principles, right? So when we launched Nest, we had an obsessive amount of understanding of exactly who was going to be our lighthouse market, projecting and multiplying our success story to other people, either through referrals or through social media or through their own micro-marketing. We knew that the purchaser was predominantly male, around 35 years old, household income of about $130,000. They were researched purchasers, which means that they go online and they compare features and benefits online between other thermostats. But the interesting thing that we did not know when we launched that thermostat was that our early adopter changed at purchase. So the person that was buying the thermostat was male, 35. The person that was using the thermostat was female. And that immediately told us that we had to change our voice in all of our marketing collateral, all of our interaction and engagement interfaces on the UX within the mobile app. And this is something that if you get it right, you can move up that growth curve extremely quickly. If you get it wrong, you will be lumped into the mass of your competitors and you'll never break into early mass growth. Okay, the next principle, the second one is focus and do less. Now, I know that sounds like a bit of a cliche, but let me just give you some numbers. The very first job I had was actually at Sony. I was working at Sony International before I moved over to Apple. And that was in the late 90s. And I was part of the PlayStation team there, designing the first generation PlayStation. Sony was a company that, if you look at 2019 data, actually, if you look at 2022 data, so just sort of bridging the pandemic, Sony had $80 billion of revenue. They have 256 product lines, right? So contrast that 80 billion with Apple. Apple had, today, they have under 30 products, but over $350 billion of revenue. And Apple can do this because they have a very strict principle of staying focused, doing less, and moving at speed. And you see that with other Silicon Valley companies as well. So the same applies whether you are a large pharmaceutical firm or whether you are a small startup. The tendency that we see with our clients today is that they try and do too much. And CEOs are essentially, going to conferences like this. They see something that's, or they hear about something that's new and exciting. They immediately take it back to their firms, and they're piling that new thing on top of everything else that the engineering team is already busy doing. And that slows down your organization. It makes people car sick, and it means you start developing technical debt and moving behind the pace of your competitors rather than moving in front of them. So another really big tip to getting this focus and minimalism working for your organization is to have something called an enterprise product roadmap. And for all of you leaders to start thinking of yourselves as product leaders, not as organizational leaders. Because that is what's going on in the medtech space now. It's what's going on in fintech. It's what's going on in military tech. Is if you want to survive in those spaces, you can no longer be an executive managing an organization. You have to start being intimately involved with your product. So Steve Jobs, who I worked with for the best part of 5 years of the 12 years that I was at Apple, he was one of those executives. He wasn't an engineer, but he was intimately involved with every aspect of every product. And he could pivot between super big picture thinking, like, I think today we're going to start talking about launching an app store and have millions of apps on an app store, to going down to a second later to talking about a little flexible printed circuit that joins the click wheel of the iPod to the main logic board. That's how involved he was. And so if you are an executive in the audience who is managing an organization but not managing product teams to that level, then in the medtech space, you're going to start slowing down. There are so many disruptors that we are involved with, coming from all different parts of the world, that we're helping to accelerate, particularly by using advanced generative AI and agentic AI. They are now moving at incredible speed and incredible focus. It's important that every executive starts thinking in the same way. The other thing about an enterprise product roadmap is that it stitches together every aspect of your organization into a single product deliverable. So whether you are the engineering team, whether you're the marketing team, whether it's your legal team, if you, as an executive, own this enterprise product roadmap and are driving your entire orchestra of employees to a single deliverable, that will deliver focus and speed. And I see very few clients, I see very few companies in the medtech space doing this. Most of what I see is a product roadmap, which is an individual set of sprints of features and benefits to be delivered by a certain date. What I don't see is an enterprise-level roadmap where those features and benefits are put in the context of your business objectives, right? If you want more on that later, I can happy to have a talk later on. So I'm out of time, so I've gone on to my last point now, which is think about the third principle is essentially have an organization that embraces product ownership at all levels of your company. So make sure that even the junior engineers coming in software projects and hardware projects feel like they are taking real skin in the game and real ownership as the same level as the chief executive. And that will develop authority, it will develop pace, it will develop excellence and attention to detail, and you'll be market leaders before you know it. Right, I'm out of time. I hope that was interesting. Thank you very much.